Go.
Okay, go. My name is Megan, and I'll be demonstrating how to properly take a patient's blood pressure. Blood pressure is an important vital sign that provides information that could possibly save a life. Taking health lab last year has taught me the proper way to take blood pressure. I'm aware of the important safety measures and attention to detail that blood pressure requires. Understanding how to take an accurate blood pressure is essential to every aspect of healthcare. Blood pressure provides early detection for potential health concerns such as hypertension and hypotension. I hope to educate people on how to take proper blood pressure and possibly save a life. Beginning the procedure, you're going to need all the correct supplies. So you're going to need a stethoscope, 2 alcohol wipes, your pen and paper, and you're going to need your sphygmomanometer, and you have to make sure the cup is the right size. If it's too tight, then the blood pressure is going to be artificially high, and if it's too loose, then it can be artificially low. And also make sure your patient does not cross their legs. So first, you're going to identify yourself and explain your procedure. Hi, my name is Megan. I'm going to be taking your blood pressure. Is that okay with you?
Yes.
And then you have to identify your patient. So will you please state your name and date of birth?
Nina, 32307.
Okay, and then if they have a wristband, you have to check their wristband. Now we have to sanitize our hands and assemble our equipment. Sanitizers on this side. And we're going to clean the earpieces and the diaphragm with an alcohol wipe. Oops. Now we are ready to begin. Okay, so we're going to start by exposing our patient's antecubital area, which is the crook of the elbow, and have them place their arm on a surface such as a pillow or table. So now we're going to wrap the deflated cuff smoothly and snugly around the patient's brachial artery. Does that feel smooth and snug to you? Okay, and if you cannot find the brachial artery, you can feel for the pulse with your fingers, or it's going to be about at their heart level. In my experience, the cuffs tend to fall down sometimes, so you have to make sure you get it tight enough, or else it can be difficult to get a reading. And also make sure you're placing it like about 1 inch above the patient's brachial artery. Place the earpieces of the stethoscope in your ear, adjust for comfort and safety. Now we can start inflating, so we're going to take the diaphragm of the stethoscope and place it over the brachial artery. Close the valve on the air pump, and make sure you don't pump it too much or it can hurt the patient. And then we're going to begin deflating it at a slow, consistent rate, about 2 to 4 millimeters per second. Okay, so we're going to start inflating to about 140, and then we're going to deflate it slowly. We're going to watch the dial as it falls and listen for the thumping sound. The first thumping is the systolic, and the last thumping is the diastolic. So at the end, you're just going to open the valve after you've got your recording and let all of the remaining air out, and take the cuff off the patient. Are you comfortable?
Very comfortable.
Good. So you're going to ask for a patient is comfortable. So the recording I got was 110/70. So the top is the systolic pressure, and you note that when the dial like starts pulsing, or when you like hear the thumps, like the first thumps. So if you can't hear the thumps, then you can look where the dial is pulsing. That's the systolic, and then the diastolic is where you hear the last thump. And if you can't hear it, you can look at the dial, and that's like where when it stops like pulsing. That's your diastolic. And then you have to make sure to record millimeters of mercury in your recording. For an important safety reminder, you should never guess or estimate on like your recording. So if you think you have an inaccurate reading, or you didn't hear it correctly, you're just going to repeat the steps you just did, and you have to pause in between like each attempt, because like last year in class, sometimes like we wouldn't like give enough time in between, and then like their arm would like start turning purple or like tingling. So that's why it's really important to wait in between attempts. And to end the procedure, I've removed the cuff and ensured my patient's safety. Now we're going to wash my hands. And then clean and return all of your equipment. So you have to clean the earpieces of the stethoscope and the diaphragm. Okay. So a normal reading is going to be around 120/80, so this reading is pretty normal, and if either are like significantly higher or lower, then it can signify either hypertension or hypotension. In conclusion, I'm aiming to educate others how to take an accurate blood pressure, which could possibly save a life. Understanding how to take an accurate blood pressure is essential to any aspect of healthcare. It provides early detection for potential health concerns such as hypertension and hypotension. I hope you understand a little bit more about what blood pressure means and how important this information is don't forget that taking blood pressure requires time and patience, and my first time doing it was tricky and it's kind of hard to hear something, so like it's just gonna be like trial and error, and it only gets easier with experience.